I'm Dr. Julia-Heya. Welcome to this video entitled How to Check Your Grandparents' Diabetic Feet if you are not a doctor. You may ask yourself, why can't diabetic people just check their own feet? Well, the reason for that is many people with diabetes have poor vision, poor eyesight. It may be due to macular degeneration or diabetic retinopathy, two very common eye ailments of people with diabetes. So they may not be able to see if they have a problem with their feet. Also, most people know that people with diabetes are at higher risk for losing their leg or their foot because of a diabetic infection or a diabetic wound. This is because people with diabetes tend to have poor circulation, especially in the legs and feet, tend to have numbness or abnormal sensations called diabetic neuropathy, and people with diabetes tend to have trouble healing an infection or a wound. The infection can be anywhere in their body, a bronchitis, a bladder infection, or an infection in their foot. So if you know someone who is diabetic, someone in your family, someone among your friends, or even a neighbor or a classmate, offer to check their feet and tell them if you see a problem. Tell them to see a doctor who specializes in diabetic feet. So let's get started. Always, before you check someone's feet, always wash hands and wear gloves. So the first thing to do is just to inspect the foot. Look at the skin. Is the skin color uniform? Do you see any blisters, rashes, bleeding? Do you see any drainage? Do you see any pus coming out? Does the skin look too dry? Do you see any calluses? Do the calluses look like they are the same skin tone as the rest of the foot? Or do you see dark discoloration within a callus? Dark discoloration within a callus may mean that there is bleeding under the skin. And that can be the first sign of a very serious diabetic foot problem. Also, check for hair distribution, especially in men. Women generally shave their legs, men generally do not. If a man does not have any hair below the knee, that may be the first sign of poor circulation. We have two large arteries, blood vessels, carrying blood from the heart down to the foot. The one runs along this part of the foot. It is called the DP artery. And the other artery runs along this part of the foot, and that's called the PT artery. If you're able to check pulses, you can check for the heartbeat of these two arteries. If you cannot pick up a pulse in these arteries, that may also be a sign of poor circulation. Be sure to check between the toes. Take your time, don't be in a rush. Look at the toenails. Is there any sign of an ingrown toenail, any sign of bleeding underneath the nail? Look at areas where pressure points can be. If a person is lying in bed, they don't turn, they can develop a blister or a wound where the ankle bones are, where the heel bone is, where the bunion is, the tops of the toes, the bottoms of the feet, etc. If you see anything questionable, again, this video is not for doctors. If you see something that looks abnormal, inform your friend or your family member. Tell them you see something that looks like an infection or a wound. Urge them immediately to call a doctor who specializes in caring for diabetic feet. Thank you so much for watching this video. Please be sure to like the video, write your comments below. When you're finished examining the feet, checking the feet, remove the gloves you've been wearing, throw them out, wash your hands. I'm Dr. Julia-Heya, reminding you to wash your hands and think of me below the knee.